afternoon, everyone. Wonderful. Well, welcome here we're so happy to be hosting you here at UNC Chapel Hill, America's first public university. We just celebrated our 224th birthday last week, and I know for some countries that's pretty young, and for America, that's actually its first public university. So it's wonderful to be here with all of you at such a fantastic conference, and I'm just really thrilled to be able to kick off the Water and Health Conference. We have a very long connection to water issues, maybe one of the longest maybe of any public university in America. Some of the earliest academic studies concerning water and sanitation and water quality began right here in the 1870s with a professor named William Kane, who was very, very interested in those topics. In 2009, our Gilling School of Global Public Health really identified water as one of the key areas that they wanted to have expertise and take what was already going here and help leverage it so it really could advance these studies in partnership with people across the globe. And they saw that as one of the most critical challenges to improving public health. And I know I'm speaking to an audience that all agree with that and have put your own personal efforts for many years at seeing this advance. At that time, we recruited Dr. Jamie Bartram from WHO, who you're going to hear, of course, from in a minute, and he became the founding director of the Water Institute at UNC. The Institute has a focus on research and policy work. It embodies really the mission of this public university. We see ourselves as a global public research university, meaning that we work in the public good and we focus on issues that are of great relevance both to our state, but also issues that are of great relevance across the world. So if you're that kind of a university and your goal is also to be of and for the public, you really do want to focus exactly on issues like this, that are issues that take the entire planet working together to really find solutions. It also, I think, speaks to wanting to be able to blend the greatest in basic research with the activities that take that research directly into action and into translation, which again is one of the aspects of this conference that I find particularly exciting, is that it is very action-focused. It's looking for best practices, it's trying to share, develop new partnerships. In my opinion, it is doing all the right things on such a critical topic. And I have my personal thanks to Jamie and the team at the Water Institute because they're really working hard to advance these critical issues and create a networking opportunity. I understand more than 600 people will be here this year, up even from last year, so clearly there's a lot of interest and people have found it a very a positive opportunity to work with people that share many of the same issues. You have an amazing conference ahead on things like drinking water supply, sanitation, hygiene and water resources with a strong public health emphasis. I just want to mention very briefly that it's also fun for me because I'm a limnologist by training. So you are my peeps, and I wish I could be here at the entire conference. But I was thinking about this a lot, how much what you study and what you have worked on all your life does really influence your agenda no matter what aspect of your work you're taking on. So as I moved into becoming a chancellor, I still have stayed very active as much as I can in advancing these issues about water. But I remember very clearly my first personal recognition as a scientist when I realized so directly that water was one of the most globally connected issues we'd ever seen. I'd spent most of my earlier career looking at things like pristine lakes. I was trying to really understand the dynamics of zooplankton patchiness in small mountain lakes. And as my career developed, I started getting more and more interested in fisheries dynamics and the relationship fisheries with human consumption. But it was when I began working on mercury and I started to understand the distribution of mercury meant that mercury coming from anywhere could actually have some of the greatest negative impacts in places the furthest away from its generation, and that those impacts could get directly into the health of mothers and babies. It became very clear to me that none of these issues, none of the things you're looking at can be looked at in a silo. They're all part of a very globally connected ecosystem. When I came here, one of the first people I talked with was Jamie. And we said, what could we do to actually try to achieve neutrality in carbon, in waste, and water. And we started saying, well, water neutrality sounds really important till we realized nobody even knew how to define it. And so we defined it, and now we've achieved it. It's a little bit unfair. But the truth is, what we're trying to do with water neutrality, that's right, we get to claim it because we defined it. But the reality is, what we said is we're going to start and say we're going to use no more water than the water that actually lands on our footprint. So that was the start of trying to find ways to use reclaimed water, do everything that you could to reduce your need of newly cleaned water from someplace else. But this is just the start. And as we started talking to people about that, we realized that even in your own backyard, you can take a number of the principles that you're all talking about and start figuring out how to make them a reality. And if we make that a reality for students that are graduating, going out into the world, then they too can become ambassadors for that kind of work. So that's another really exciting aspect of this conference. We know that our students and other students may be here to mingle and mix and learn from you. They have a chance to really talk to leaders from across the world who have been so dedicated to doing the work that you're doing. And knowing that there is much work to be done on the national and global stage is not a reason not to get involved. For most of our students, that is the reason to be involved. They want to be part of making change that is important, is going to have an impact on lives, that is going to be something bigger than what they can do themselves. So again, this conference and your interactions, the way you work together, becomes a real model for emerging generations of students who are also interested in finding a path to real relevance in the public good. So I thank you for being here. I really appreciate this concentration from science to policy, focusing on needs to urgency, engaging with people from across the spectrum of all these different fields. I think it is really a model for the way much of the science that we see coming out from universities across the world needs to be accelerated so it can have its relevant moment in the public conversation. You're going to hear a panel in just a moment talking about the road ahead, understanding the baselines, indicators, and hurdles to basically achieving the SDGs and then moving from those to the Millennial Development Goals. And I think that's also a very ambitious and very exciting aspect of this conference. I love the idea that the goal is to really leave no one behind. And again, for a public university, for all of you and what you do, leaving no one behind is probably the highest goal that we can think of. It's for everybody, and making the things that we can take for granted in some of our parts of the world available to everybody across the world. So I think in closing, I just want to cite something that Jamie Bartram said in the Institute's 6-year report. I think it's wonderful. He said, "The Institute stands for working with others to make the world a better place rather than describing and lamenting about the inadequacies around us." You know, nobody ever gets anywhere by just complaining. We all know that, although pointing out truth is really important, but you get there by acting, coming together, and putting a focus that has a long view with a determination to get there. That's what I see in this room, and I hope for all of you that's what you'll feel at the end of this conference, that you really were able to come together and take some more steps forward. So thank you so much for being here. We welcome you to Chapel Hill, and although I know that water is life and it's wonderful, I think you're going to have a few sunny days as well. Thank you very much.
Good afternoon, everybody. By means of introduction, my name's Jamie Bartram. I direct the Water Institute here at UNC, although I think you've worked that out already. I would like to begin by recognizing and thanking Chancellor Folt for her comments. And I can say honestly, it's inspiring to work with a leader who can articulate clearly the role of a public university on a global stage. And I'm going to quote back to you a phrase that she has used, which I think perhaps encapsulates something about what this conference stands for. And it's one of those horribly short, simple statements. The future, it's ours to create. And I think that's the undercurrent of a lot of what we'll be talking about in this first session of the conference. I'd now like to turn to everyone that's here and welcome you to the 2017 Water and Health Conference, where science meets policy. It's a real privilege to look around the room and see both familiar faces, people who've been with us here before, but also to see new faces and to see new ideas starting to emerge. So thank you for being here. This is our 8th conference, and it was, as always, it's thrilling to review the proposals we receive for sessions and see what it is that people want to talk about. We set out with this conference to, first of all, to provide a convening space, to bring together science and policy perspectives around water, sanitation, hygiene, and health. We do set out to advance the science itself, to try and push forward our collective understanding and our ability to act. And we try to use the conference as a way to strengthen the communities of which many of us here are parts. And over the last 8 years, we've seen a number of those communities use this conference as their gathering space. We have the HWTS network. I'm not going to read out all the acronyms, they get quite long. We have the Washing Schools network, the Biosand Filter community, the Ceramic Water community, the Virtual Menstrual Hygiene Management Conference, which is hosted by UNICEF with the Mailman School of Public Health, all taking place from here. And that, for me, is one of the ways that we can contribute to assist in developing the community around our subject. Over the weekend, I was looking back over the proposals and submissions that we received for this year's conference, and it struck me that over the 8 years we've been running this, there's been a slow, steady evolution of the themes that people want to talk about. If we go back to 2010, water dominated the proposals that we received, the proposals and the abstracts. And over time, we saw that shift quite steadily over towards giving sanitation a much more prominent position. And if I look at this year, what I see is much more attention, or increasing attention, that's trying to understand the links between science and policy. And that's has always been intended to be the heart of the conference. And it also struck me that, unlike some earlier years, our subject matter is in the news, it's on the television. If I turn on and pick up whether it's CNN or the BBC or whatever, but we see flood, drought, disease outbreaks, and reporting about inequalities all getting regular or frequent attention. Now, unfortunately, they tend to get attention when they are bad and when there is a problem. But it seems to me this is a signal now that some of our subjects are very much in the public eye, and there is real opportunity for us to engage that energy and take it forward. I'd like to use the opportunity of being here at the beginning of the conference to express my thanks and recognition to the sponsors that help make this possible. Without them, we would not be able to put this show together and to make it possible for us to all meet here. I'd like especially to ask you to join me in thanking our 2 platinum level sponsors, the Bill and Melinda Gates Foundation and the Osprey Foundation. So can we thank those particularly? And I'll mention that the Gates Foundation particularly give us funds towards some scholarships that enables participation of the most promising scientists from low and middle income countries. I think that's of huge value. I'd also like to recognize our other sponsors. I'm going to ask that we hold the applause to the end, because otherwise it will be this evening before we get to the end of the list. That's not good. Gold level, we have P&G's Children's Safe Drinking Water Programme, and Watermill Express and World Vision. At silver level, we have the International Association of Plumbing and Mechanical Officials and Kohler Clarity. At bronze level, we have the African Studies Centre here at UNC, the Antenna Foundation, Aquagenics, Aqua Research, Aquatabs, lots of aqua, you noticed. Catholic Relief Services, MSR Global Health, NSF International, Plan International USA, Practical Action Publishing, RTI International, Sawyer International. There's a pattern, have you noticed? They're all either aqua or something international. Sawyer International, SNV, Tomlinson, and UNC's Institute for the Environment. And at the level of Friends of the Conference, the publishers Elsevier and FHI 360. So could we thank and recognize them together? And to round out my thank yous and recognitions, in addition to the support we receive from Chancellor Folt, I should recognize Dean Barbara Reimer of the Gilling School of Global Public Health, where we are hosted, and the role of the Department of Environmental Sciences and Engineering in the school. Probably the most important thank you I can do is to everyone who's in the audience. The conference works and helps because we meet here and we exchange and we're candid in our discussions and we learn. So thank you for everyone for turning up here. I find it remarkable just how collegial our community is, and I feel privileged to be a part of that. I'd now like to turn the attention from the introduction to the conference as a whole to this afternoon's main event, a discussion around the global effort to achieve the Water and Sanitation Sustainable Development Goal, and in particular targets 6.1 and 6.2. Many people here have been to these conferences before, and you will know that we like to include an element in these plenary sessions that originally looked at the MDGs and now turns towards the SDGs. For this year, the session is entitled Understanding Baselines, Indicators, and Hurdles to Achieving the SDGs. What we've lined up is a conversation amongst a group of panelists who we are going to ask to help us interpret and understand the implications of the most recent WHO UNICEF Joint Monitoring Programme assessment. And that's the first assessment of the SDG period. And I'm hoping that they will assist us to reflect on the steps that we need to reach those ambitious but exciting targets by 2030. So the way we're structuring this session, in a moment, I'm going to invite Rick Johnston and Tom Slaymaker to step up here to remind us of the findings of that new report that was launched over the summer. We've decided we'll allow a brief period for any questions and answers to Tom, and the idea is that that's for clarification. We don't want to yet move into interpreting what they give us, but making sure that we understand what that picture of the world is that they are presenting to us. Following Rick and Tom's presentation, I will turn to Param Iyer, the Secretary of India's Drinking Water and Sanitation Ministry, who will make a brief presentation. And then I will introduce our 4 other panelists. We'll have a conversation amongst that group, and then we will also turn back to the audience, so everyone will get a chance to put some questions up to the panel. Now, with that explanation of how we hope this runs, I'd like to invite Rick and Tom up here. The stage is yours.
Thanks so much, Jamie, Chancellor Folt, distinguished panelists, participants, thank you all. It's exciting to be here and to present results from the first SDG baseline assessment produced by the Joint Monitoring Programme. Our program is a joint program between WHO and UNICEF, so the presentation will also be joint. I'm going to start off by showing some of the highlight numbers, and then Tom is going to go into more detail, especially about the inequalities. But we will also have an opportunity tomorrow to go into yet more detail about the specific elements of the indicators. So I'd also like to invite you to join our side event tomorrow morning, the first half of the morning. So with that, let's get into some numbers. It's been a long road to the SDGs, but it's been a road that many people have been walking down together, including many people who are in this room today. One of the first seminal events in planning for the post-2015 processes was a meeting held in Berlin in 2011. I see some people who were involved in organizing and participating in that meeting. And that led to a process in which WHO and UNICEF convened technical working groups in 4 thematic areas around water, sanitation, hygiene, and equity and non-discrimination. And these groups drew upon experts from the sector, from monitoring, from national perspectives, from the human rights world, to review the experiences of the MDGs. What worked well in the MDG indicators of improved and unimproved water and sanitation facilities? What were the gaps? Among the gaps, what could be filled practically? And those 4 groups came up with their individual proposals. I think it's important to see that equity and non-discrimination was one of the groups, and their recommendations, which Catarina led this group, Catarina de Albuquerque, they underpinned the proposals that emerged from all of the working groups subsequently. So through 2012 and 13 then, those working groups deliberated, produced proposals. Those were then consolidated into one joint proposal, along with proposals from other sector partners working in other aspects of WASH, in water resource management, in environmental aspects of WASH. And UN Water played an important role at this stage to bring those all together into a package to propose for a global goal around WASH, around big water, water sanitation, but all these other aspects of water. Now, we didn't know if that would happen, if there would be a dedicated goal for water and sanitation, or if it would be what the framework would look like. So this technical consolidated proposal fed into a more global political process, where there were many different actors. And it was a very confusing time, because nobody really knew what framework was going to emerge. There was the high-level panel, the Sustainable Development Solutions Network. The UN held a thematic consultation. In the end, the open working group, which is a group of member states, ended up proposing a framework that became what was then endorsed in 2015 by the UN General Assembly through the Transforming Our World 2030 Agenda, the 2030 Agenda for Sustainable Development, which did include a dedicated goal for water and sanitation. So that was a big victory right there. But in a sense, that was 2 years ago now, and that started the clock on the Sustainable Development Goals. But then it took quite some time to operationalize this, to define, to move from targets to indicators, and to methodologies to measure those indicators. So from 2015 to 2017, there was a lot of this methodological work being done by the broad Goal 6 stakeholders through the GEMI initiative, or the Integrated Monitoring Initiative for SDG 6, also through the JMP and the technical working groups. The Interagency Expert Group on SDGs is a group of member states that has the mandate to oversee and endorse and finalize the indicator frameworks. So they've been reviewing the technical proposals, classifying them into tiers 1, 2, or 3, where 1 is really something that's practical and ready to move. I'm happy to say that the indicators for water and sanitation were and are today tier 1 indicators, but even in tier 1 indicators, there are further developments that need to happen over time. But in the same period, 2016 especially, we developed our methods within the JMP. We conducted a big data drive to collect information for the new indicators, and then drafted new indicators, sent them out for a country consultation. We always do this to make sure that the data that we have collected and interpreted are correct, that we're not missing things or misinterpreting them. And that all led to publication in July of this year of our progress report, which introduced the new indicators and also the global baselines. If we look first at drinking water under target 6.1, we build on the MDG indicators of improved water sources, use of improved water sources, but add new service elements. In fact, there's quite a theme through the whole SDG framework of moving from infrastructure, from use of certain types of facilities, to use of services and different service levels. So in the drinking water ladder, we will carry on monitoring the people at the bottom of the ladder who are drinking water from unprotected surface water sources or sources that have only marginal protection, such as unprotected dug wells or unprotected springs, as in the MDGs. But now the people who are using improved water sources can be split into 3 new categories. And if those improved water sources are distant and require more than 30 minutes to go there, collect water, and return, it's an improved drinking water source, but it's not really adequate. And this is what we're calling a limited drinking water service. If that water point can be reached and water collected within 30 minutes, then that would count as a basic level of service. And while a lot of us are focused on SDG 6 for water and sanitation, there's also water and sanitation in other goals and targets throughout the 2030 agenda. An important one is under Goal 1, the poverty goal. There's a target for universal access to basic services, target 1.4. Water, sanitation, and hygiene are basic services, and they fit into the monitoring for target 1.4. But at the top of this ladder, then, comes the new indicator of safely managed drinking water services. And that's defined as drinking water from an improved source, like the MDGs, but one that's got these 3 new elements in it. It should be located on premises, the water should be available when needed, and should be free from fecal and priority chemical contamination. So those 3 service level elements should all be combined together, actually, in order to yield a service that would be counted as safely managed. So we pulled together data from many different sources. We have traditionally relied on household surveys, but for these service levels, we needed to turn to other sources of data. We drew on administrative data, data from regulators, data from ministries, especially around drinking water quality and availability. And we were able to get enough data to say at a global level that 71% of the population, 5.2 billion people, used a safely managed drinking water service that met the 3 criteria. We were able to make estimates for 96 countries. And the SDGs have also introduced new regional groupings, SDG groups. You see them on the right. And we were able to make estimates for 4 out of the 8 SDG groupings. If we look also at the basic level of service, we see another 17% of the global population. So in total, 6.5 billion people in 2015 were using at least a basic service. But of course, that means that there were still 844 million people lacking even a basic service. And among those people, 263 million were using a limited service with a long travel time, and 159 people were still using surface water sources. So a lot of questions about how these numbers were generated. And we're very upfront about recognizing that there were big data gaps. We were able to collect enough information for these 96 countries, but we have rules about at the regional level or the global level, there should be a certain proportion of the population covered in order to make an estimate. And our rule for households, for country estimates, is that we should have at least 50% of the population covered. In fact, we often have much higher percentages. But then to make a regional estimate, we would want to have at least 30% of the population in that region or at the global level with data available. And here you can see the different regions and a big spread in availability of data. Now, these aren't the levels of service. These are the proportions of the population that we could find data on. So you can see this light blue, accessible on premises, we are data rich. There are many sources of data about whether supplies are located on premises or not. But available when needed, relatively less, especially in certain regions. Free for contamination. Again, in some regions, quite good, in others, not so much. However, at a global level, we were able to get, 100% for accessible, but about 40, 45% for these other indicators, which allowed us to make those estimates. So if we look at how those different service level elements are combined, well, first we can see that globally, there were 92% of the population using an improved drinking water source, and only about 4% of them having limited services at a global level, though at a country level or in certain zones within a country, it can be much higher. So that gives us 89% with at least a basic service. But these three service elements, accessibility, availability, and quality, at a global level, actually end up being pretty similar in the 73 to 79% range, though again, in any given country or setting, one of these might be very much higher or lower than the other. They might also come from different data sources, so we can't combine them at the level of the user or the household. So what we do is we combine them at the rural and the urban level, simply by taking the minimum of the three as the limiting factor. Then we use population weights to combine to get a national estimate, which is where the 71% figure comes from. So 7 out of 10 people globally then with safely managed surfaces in 2015. If we look just at the basic level, we have a lot more data on the basic services improved within 30 minutes. We also have historical trends on this one because the data go back much further. So we're able to look not just at the current status, but also the trends. So this graph shows the change, the annual rate of change in percentage points per year. And you can see that there are quite a lot of countries in this, maybe 1 percentage point change per year zone, which if you're already, above 90%, that'll get you to universal basic if you would carry on with that rate of progress by 2030. But if you're in the 40 to 60% range, 1 percentage point a year is progress, but it's not sufficient progress for universal access. So with this analysis, we were able to show that only 15 countries out of the countries that don't yet have above 95% basic services are on track to get universal basic within the SDG period. So there needs to be progress acceleration even at the basic level. Moving to sanitation, we follow a very similar approach where the bottom rungs on the ladder are monitored in the same way that they were during the MDGs. So we have open defecation, which is mentioned explicitly in the text of Target 6.2. That'll be tracked in the same way. And unimproved sanitation facilities. The people who are using improved sanitation facilities, again, are classed as having a limited service if that sanitation facility is shared by 2 or more households. If it's not shared, it would count as basic or better. And then the new service elements for the safely managed level are that they shouldn't be shared with other households, but that the excreta should be safely disposed of in situ or transported and treated off-site. And there are really 3 ways that waste can be considered safely managed, or people can be considered to have safely managed services. They can, there's safe disposal on-site, where the wastes never leave the premises. Or if you have on-site sanitation that's emptied and removed and treated off-site, that can count. And then finally, you have waterborne wastewater sewage connections that lead to treatment and also safe management. So globally, the numbers are lower for sanitation than they were for water, as in the MDGs, but still we were able to bring together enough data to meet that 30% threshold and make global estimates, and also estimates for 5 out of the 8 SDG regions, and for 84 countries. And from that, we could show that 39% of the global population, 2.9 billion people, were using a safely managed sanitation service in 2015. And if we include the basic level of service, 29%. An additional 29% brings it up to 5 billion people having at least a basic sanitation service. Of course, that leaves 2.3 billion people lacking even a basic sanitation service, of which 600 million are using shared improved facilities, and almost 900 million people still practicing open defecation in 2015. Now, if we break that up into the individual components, you see 76% of the population using improved facilities, and when you account for sharing, 68% at least basic. But that 68%, we can also break that up into people who have sewer connections and those who use on-site sanitation facilities, such as septic tanks or pit latrines. And we see globally 36% of the people having sewer connections that aren't shared, and 32% using on-site sanitation facilities that aren't shared. When we combine that then with data from the sector about wastewater treatment, we come up with 27% of the population having sewer connections that lead to treatment, and 13% of the population using on-site sanitation facilities that are not emptied and where the wastes are considered to be safely disposed of in situ. Now, what you're not seeing here is how much of the population uses on-site sanitation facilities where the wastes are emptied and treated off-site. Doesn't mean it's not happening. It means that we were unable to find data to describe this. And this applies to high-income countries as well as to low-income countries. It applies to the US, which in fact was one of the largest populations using on-site sanitation facilities where we were unable to collect data to make an estimate about this one. So we do expect that going forward in future years, these data gaps will be filled because this is, again, just the first report. If we look at the rates of progress, well, the first thing you see is that there are more countries that have lower levels of basic sanitation services, so that means they have a further way to go. But you see still a lot of countries in the, around 1 percentage point per year level, and, 14 countries that if they maintain the current rates of progress, would reach universal basic by 2030. Many more countries not on track for universal basic, and again, a small number of countries where the basic sanitation services are actually decreasing. Another of the big successes, I would say, in elaborating this framework is that hygiene is present. Hygiene is specifically mentioned in SDG 6.2. There was a major lobbying effort around this, and we're very pleased to have it in there. And we've developed a ladder for hygiene. We've put it on the cover of our report, and we've also changed our name. We're now the Joint Monitoring Programme for Water Supply, Sanitation, and Hygiene. So, yay for hygiene. Let's just clap for hygiene. We've also developed metrics for measuring hygiene, and this has been going on for quite some time. Since about 2009, many of the main household surveys include questions about availability of hand-washing facilities in the home that are then checked by the field teams to see if water is available and if soap's available. We know that if you simply ask people about their hand-washing practices, you don't get reliable data, but this seems to be a fairly robust one. And that tracks to both the basic target in 1.4 and safely managed, or target 6.2. However, even though it's in those household surveys, not every country is doing those household surveys, so we face actually bigger data gaps on hygiene than for water and sanitation. We could only make estimates for 70 countries and for very few high-income countries. So you can see by the regions here where more of the data were collected, and actually sub-Saharan Africa and Western Africa and Northern Asia were the only two SDG regions where we had enough population coverage to make estimates. And you see huge variability there, with only 15% in sub-Saharan Africa having these facilities, compared to 76% in West Asia and Northern Africa. And in a lot of sub-Saharan Africa, even less than 50% of the population had these basic hand-washing facilities in the home, and much less, we don't know, even when people have the facilities, how much those are used. So those are the new indicators, the new baseline levels, but another thing that we've been focusing on and is central to the SDG agenda is that of inequalities, of leaving no one behind, of seeing who's benefiting and who's not benefiting from services. So Tom is going to walk us through some of the data on inequalities.
Okay, thanks, Rick. So you've heard a lot at the headline aggregate level. I'm going to unpack a little bit what's new and different in this report when it comes to looking at inequalities. And I'm going to start with open defecation. So as you probably know, there is an explicit reference to ending open defecation by 2030 in Target 6.2. And what we see is that while open defecation has come down as a proportion of the population in all regions of the world, it's not coming down sufficiently quickly in order to meet this target. And we also see that the population practicing open defecation are now heavily concentrated, with 2/3 in Central and South Asia, 9 out of 10 in rural areas. But also, while the rates have come down, the actual number of people practicing open defecation has actually gone up in sub-Saharan Africa and in Oceania. And that's to do with very rapid population growth. If we think about those countries that Rick showed you on the graph, which are making progress towards universal basic services, and they're based on their annual rates of change, we can actually single out a particular group of countries which are consistently falling behind. And in the report, you'll see we've done some analysis on what are called fragile states or fragile situations. This is a World Bank classification of countries which have a particular CPIA score. That's a governance score, and are also subject to large humanitarian responses. And we see consistently at the global level that there's a big difference between fragile and non-fragile. So in 2015, if you lived in a fragile situation, you would be 4 times more likely to lack basic water services and twice as likely to lack sanitation. You see that pattern repeated across all of the regions, and it's particularly acute in Oceania, slightly less so in sub-Saharan Africa. So if we're going to achieve universal basic, then we will need to be concentrating our efforts, particularly in these countries. In this report, there's also a lot of new information on inequalities. And when we talk about inequalities, we have historically done a lot of work on inequalities between rural and urban. We're now also looking at wealth quintiles and also subnational regions. So when we say subnational regions, that's the first level, administrative level, below the national level. It's called something slightly different in each country. And so these graphs show you, taking the example of specific countries, where those countries are situated in relation to the region in which they sit and in relation to the global average. And then we zoom in and we look at inequalities within the country. So top left is basic drinking water. And we're looking at Angola, which is in sub-Saharan Africa. And within sub-Saharan Africa, Angola is relatively low, one of the lowest in terms of national coverage. But if we zoom in further, you see there's a very big difference between urban and rural. But also, we can look at wealth quintiles. And the difference between the richest and the poorest wealth quintiles, in the case of Angola, is huge. This is 80% amongst the richest and just 15% amongst the poorest. So that's a 65% gap. We can do the same for sanitation, basic sanitation on the top right. That example's from Panama. And there we see that generally speaking, Panama is doing relatively well within Latin America and the Caribbean region. The differences between urban and rural are not so great. And although the richest have nearly universal access, the spread between the richest and the poorest is also smaller. But the difference between the subnational regions is huge. So if you live in Panama province, then you will have universal access. If you live in Gunayala province, which is an indigenous province in another part of the country, you see coverage is way down at around 1 or 2%. So this is a way of shining a light on the work that remains to be done in these countries. Tunisia is a good example for hygiene of a country that has achieved a relatively high rate of coverage, around 86%, but there are still quite big gaps between rural and urban and between rich and poor and subnational regions. And Bangladesh, in bottom right, this is an example of open defecation. So we all know that Bangladesh has been a great success story in terms of efforts towards ending open defecation. So at the national level, nearly 100% not practicing open defecation. We've reversed the axis. And even in urban and rural areas, at the average level, we have very high rates of coverage. But then we still see, once we get down to the subnational regions, that there are big differences, and in particular, in Rangpur, we see that there are still around 16% of the population practicing open defecation. So these new disaggregations allow us to go further. Also, in order to calculate safely managed services, we have to disaggregate facility types. This is looking at on-site versus sewer connections at the global level. And globally, and this was a surprise to us, and it may be a surprise to you, we see roughly equal proportions of on-site versus sewer connections. But there's a very big variation across different regions of the world. So, for example, if you're living in Europe and North America, or Australia and New Zealand, clearly the vast majority have sewer connections, very few with on-site. And in sub-Saharan Africa and Oceania, it's the opposite. But there's some really interesting questions about the regions in the middle, and individual countries have a very different mix of sanitation and drinking water technologies. And these will determine the possible routes towards achieving sustainable and safely managed services in future. This is just to give you an example from a country I visited recently. I won't tell you what it is, but there'll be a prize if you can guess later on. And I was speaking to the minister at the beginning of the meeting, and he said, well, we have around, only about 50% of the population that have piped drinking water and piped sewer connections. And then when we sat down to look at the data, you see that actually he was absolutely right about the piped drinking water. But on the piped sewer connections, it was a very different story. And in fact, the sewer connections were a very, very small proportion, between 1% and 3%, and not really changing much over time, whereas you've seen a massive increase in septic tanks over that same period. And so that has really important implications when it comes to planning how we manage these services going forward. We can also break out the different elements of safely managed drinking water services: accessibility, availability, and quality of drinking water. And we can plot these. So this is just a selection of countries that were identified in the report. Remember, we only have 96 countries for which we're able to make these estimates. But you can see that there are important differences both in terms of the spread between the proportion using an improved source, which is accessible, available, and free from contamination, but also that the highest and lowest elements in each country vary. So, for example, in Uganda, the limiting factor there is really getting water on premises, whereas in Ethiopia, which is the next country, it's about drinking water free from contamination. So this is informing a discussion about where the problem is and what we can do about it. There's also a lot of new data that we've included on expenditure. We were asked to look at affordability because it's part of the drinking water target. But we're starting from a very low base. So we've been working with the World Bank, which has a very large database of surveys, income and expenditure surveys. And within that, we were able to find information about what households are spending on many things, including drinking water and sanitation services. And to be able to calculate then the proportion of spending on WASH as a proportion of annual expenditure. Now, we're able to make some rough estimates for those 52 countries, and there are 6 SDG regions here. And what you see immediately is that there's a very large proportion of the population which has no payment recorded. Okay? But also amongst those that are paying for services, we see quite big differences. The majority spending between 0 and 2% of annual expenditure. But in some regions of the world, it's getting above 3% and in some cases beyond 5%. Now, there is no commonly agreed metric of affordability. There is no universal benchmark, but we are starting to get some information on expenditure. Now, what we don't know is what people are paying for. And we also don't know when households are not paying anything and not accessing anything. So this is a limited set of data, but it gives us a starting point to understand this question of affordability. Coming soon, coming next, in our next report will be schools and healthcare facilities. And there's a lot of discussion here in the conference about that, so we're not going to go into detail here. But I really wanted to highlight this because we have such a lot of new information, it's also coming from a much wider range of sources. So traditionally, we've mainly focused on censuses and household surveys, We're now building on that with information from regulators and from the sector, the administrative data systems and sources. So, for example, in the case of Portugal, we were discussing over the weekend the regulators' data on drinking water quality, and that has been used in our new estimates. On the other hand, recent example from Ethiopia, where we've been supporting a household survey and the integration of water quality testing within that household survey, which has enabled us to establish a baseline estimate for safely managed drinking water. We've also worked closely with the Bill and Melinda Gates Foundation on trying to unpack this whole concept of safely managed sanitation services that Rick was describing, and understanding what that means from a data perspective, the different steps through containment and storage and transport and treatment. And of course, we have new data coming in on schools and healthcare facilities. But there are some very big data gaps. Okay, this is the first baseline. We expect that the data will improve over time and that our estimates will improve with it. Open defecation and universal access to basic services, we have estimates for almost all countries, with the exception of hand washing with soap and water. Now, of course, we're still prioritizing data that comes from households about the types of services that they use, rather than information about the number of water points that have been built or the number of toilet facilities that have been built. But we're now building on that with information about service levels in order to assess progress towards safely managed. And while we have estimates for over a third of countries and a lot of data on, for example, wastewater treatment, we have very little data on fecal sludge treatment. We have quite a lot of data on accessibility and also on availability of drinking water, but relatively few on drinking water quality, and especially in rural areas. So this is our agenda going forward, is thinking about how to plug these gaps. And for WHO and UNICEF, as we engage in this national dialogue about what it all means, there are a number of different elements to this. Firstly, we're having conversations with Norway and Sweden and with Tanzania and Malawi. In the MDG era, it was all about Tanzania and Malawi, and now it's an interesting and it's a different conversation. We're struggling to find hand-washing data for high-income countries. We're struggling to find information on on-site sanitation for high-income countries. And so there's tremendous potential for cross-learning, which I think is very interesting and very positive. But we do expect all countries to be setting some kind of national target related to the SDGs and to thinking about what would be ambitious but also achievable. There's a lot of confusion at the country level about how to interpret the SDGs, but the understanding is that countries will customize them. They will not simply copy and paste the global targets. They will customize them according to local context. So thinking how we can support that with the data and estimates we have. And it raises some really interesting questions about targeting and sequencing of investments, whether they're government investments or investments from our external support agencies. The balance between investing in basic services and improving the quality of existing services, and thinking about how that can be done. So, for example, going beyond simply collecting information through household surveys and censuses and strengthening the overall regulation and the sector information management systems, which we need in order to be able to assess progress. I'm going to leave it there, and I'm going to encourage you to ask questions, but also if you want to find out in much more detail about all of this, please do come to our session tomorrow.
Could I ask you both to stay up here a moment longer? We've reserved a little time in the schedule, so there's a little bit of time for some questions and answers. If anyone would like to, I was going to say throw, that sounds very bad, doesn't it? Would like to direct any comments or questions to Rick or Tom, could you make your way to one of the microphones on the two sides? And I'd like to ask anyone that does to say who they are, their institution, and try and be reasonably brief. I think everyone's going to be so brief that there are no comments whatsoever. Every time I see someone making their way towards the microphone, they're going out to the nearest sanitation facilities. The microphone's over here. And I'm going to suggest if there are some comments, we'll take 3 or 4 rather than let this become a ping-pong back and forwards with our speakers.
My name's Clarissa Brocklehurst, and I'm part of the Water Institute here at the University of North Carolina, and I know a little bit about the JMP. As you know, having been with Jamie at the seminal Berlin conference. I'm going to put to you a question, or sort of be a bit provocative, on a subject that we've engaged about before, which is, as you put together this now extremely imperfect data set for safely managed, both water and sanitation, I mean, it reminds me of many years ago with the JMP, with the data sets we had with household surveys. They were also imperfect, and it takes years and years and years to build up a robust data set that really that you have a lot of confidence in. And I think you've been very right in the way that you have qualified a lot of the data that you've got here, that it's an incomplete data set. So my question, and I'm trying to be a bit provocative here, is what do you suspect is going to happen as more data come in? Which way do you think the estimates are going to go? I know that I'm probably not the only one that was quite surprised at 71% safely managed water. Actually, more than surprised, astonished, I think, perhaps, is closer. So I'm just wondering, do you suspect that what's happening is you're getting more data from developed, industrialized countries because they're the ones who have the regulatory data? Is that skewing your database, or would you argue that perhaps, in fact, it's the opposite? So that's my question to you.
So transformational change, but what's going to happen as we get more data?
Thank you for that interesting background, Kellogg Schwab, Johns Hopkins. I'd like to get your thoughts on some of the issues going on, main versus regular use of both water and sanitation, and how that will integrate back in as we also collect more data. And my comment also would be is, I appreciate you're working with high-income countries in there. It seems to me if we're resource limited, we might want to focus in on the low incomes about hand washing in there, but I appreciate this need of collecting data where, Semmelweis 100 years ago had figured it out. So where do we really want to focus time and energy with potentially limited resources?
So part of that is about multiple source use. That's the first part, wasn't it? Okay, great. Over this side?
Hi, Anna Murray from Charity Water. And to follow on to the first question, as a consumer of this information and seeing these new numbers come out, what do you expect the frequency of reporting on this, understanding that it's much more complex than it has been in the past?
Hi there, my name's Nina Hall. I'm from the University of Queensland in Australia. Thank you so much for being here and presenting directly to us. It's such amazing access to have you in the room and explaining us through your report. Quick question that I know you will have had before, but it's just about hygiene. Really want to applaud the inclusion of hygiene into the JMP, but the question is going beyond just the hand washing dimension of hygiene to all the many other dimensions, including the fact we've got the menstrual hygiene management virtual conference here on site as well. Obviously, that's another dimension of it.
As we've got 2 other people up here, I'm going to suggest we let the questions come up, and then we'll turn to you two to go a little bit further.
Thank you. Good afternoon. My name is Yanita. I work for Watershed in Cambodia. Thank you very much for the reflection on the methodology and the data sources. I'm wondering what role does big data and sort of new data sources of the 21st century play in getting together the JMP indicators? Thank you.
Hi, I'm Denai Rumas from Social Impact. I work on impact evaluations and have been working on some urban water projects recently. My question is actually kind of similar. We collect a lot of the data that's now feeding into these new indicators in different household surveys, and I was wondering, with a parallel move to open data and publishing data from all kinds of evaluations, if there's going to be an effort to sort of integrate some of that data to triangulate or supplement the national surveys that you use for these indicators with things, not just household surveys, but a lot of work with sensors and other kinds of data now that can speak to things like availability. Thanks.
Okay, 6 great questions. Can you share them between the 2 of you somehow?
I'll take the first 3, and I'll take the second 3.
I think that was a hospital pass. Did you see that? Yeah. You do this one. That was the difficult one.
Okay. Sure. Thank you. Well, maybe I'll start with hygiene. We are so happy to have hygiene in the framework, but I think it would be entirely inappropriate to invest a lot of resources for Sweden to find out how many households actually have soap and water in their homes, like to do a big national survey on that. So I think what we'd like to do is come up with appropriate proxies that could give an indication about the likelihood of facilities. Remember, we're not talking about practices. But the challenge there is to find a proxy that we can apply equitably. And it's not that we're going to have one set of rules for Sweden and a different set of rules for Moldova or Ethiopia. We need a consistent framework. So that's something that we have plans to work on. You might also want to say more on MHM, but certainly on hygiene, we see the availability of hand washing facilities as a first step towards a discourse on hygiene. We do have other bits of hygiene in the schools and healthcare facility frameworks that look at hand washing at points of care and healthcare facilities, at toilets having menstrual hygiene management facilities. So I think there will be other aspects of that, especially outside of the home. Multiple uses of services for water sanitation. This is complex, yeah, and there are some innovations on a methodological front that do allow teasing out of complex practices, what different sources of water people use at different times of the year for different purposes. And I think we will see more analysis of that, but that it would be, at least at this stage, very difficult to incorporate that in a global framework because they do tend to be quite different and limited data sets. So I would put that in the area for methodological development going forward. On data gaps, Clarissa asks, as we get more data, what's the impact going to be on the numbers, things like that. I think numbers could go up or down. I can see both cases. No, I'm serious. Come on. There are a lot of rural households who have on-site sanitation systems that are never emptied and should be counted as safely managed by our definitions, but there's no data to show how many of them are emptied. That's a relatively easy fix. That's getting a couple questions in an upcoming survey. And countries that have that data gap are really going to want to fill that. So I think we'll see an increase in that 13% to be a bigger number. Drinking water quality might go the other way. The household surveys that we do, they give one snapshot for one day. Not one day, but one period. And certainly, if you would look at longitudinal analysis, you might get a very different picture. So, we'll see what time brings, but we'll have a better picture. I just can't say if it's a higher or lower picture.
So I think the last point, just to add on Carissa's question, it's not just a question of data gaps. I just came back from the Middle East, North Africa, and we're having a big discussion there about how countries are progressing towards safely managed drinking water, and actually many of them going backwards. And I think in the MDG period, when it's been about building infrastructure, we've seen a steady progression. But with service levels, we can expect them to go up and down. And so that makes it more complicated. So it's not just a question of, are you on track to meet the target? Overall, it's about progress within a shorter space of time and whether you're maintaining progress that you've made and you're not slipping back. So it's getting more complicated. On the frequency of our reporting, we will continue to report every 2 years. And in the in-between years, we will focus on specific issues. So next year, we're focusing on washing schools and healthcare facilities. But all of our data is national data. So there's nothing in our database which is not produced by national authorities, and that is produced all of the time. So we have periodic updates which take account of all of the new data that has been collected in the last 2 years. At the moment, that is all official data. This is official reporting, and we use official data that has been approved by the relevant ministry, the National Statistical Office, or the regulator. There is an ongoing discussion about other possible sources of data that could be used to triangulate for SDG reporting. I think it's an interesting discussion, and that includes big data or new data. I think The most exciting thing for us is the new approaches to data collection through official mechanisms, because there's a lot going on. I mentioned drinking water quality testing through household surveys, but also a lot of ways of moving data around faster so that you can collect it, analyze it, and getting it into the system quicker than ever before. Going back to MHM that you left for me, this is super important. It is not part of the sort of global metric at the household level, but it is something which is now being embedded in household surveys systematically. It's going to yield a lot of very interesting information about whether women and girls have a safe place to wash and change, the types of materials they're using, and whether they face particular barriers, social barriers or educational barriers during their menstruation. So we are starting to collect that data, and once we have it, we will start to analyze it, even if it's not part of the official SDG indicator set. We have always reported on more than just the official indicators, and we'll continue to do that.
Thank you both. Could we do one more round of applause? Cheers, thanks. I'll resist the temptation to say, especially for the insight, that numbers may go up as well as down. But allow me, I think, to reflection, and Clarissa, I hope you will allow me to invoke your voice. I think it's quite remarkable, having lived through the period of making sure that water and then sanitation were actually included in the Millennium Development Goals, seeing the transformation of the richness and the quality of the targets and the indicators around WASH is really something quite remarkable. And we can criticize the data and so on, but there has been a transformation in the last 5 years of the status and the quality of the information that's coming back. And I really do want to comment on that. I'm fascinated by the fact that if you look at the basic level of access, drinking water and sanitation are now so close to one another. So that great gap is not what we once thought of it. And it's also remarkable that back in the early MDG period, the move was very forcefully away from official data because they were considered so unreliable. And now we're coming a full circle back round again to say we need to listen to governments and look towards competent national entities. So I think this has been a truly transformational period, and thank you for the leadership of your organizations in that. It's a pleasure and a privilege for me now to invite up our next speaker, India's Secretary for Drinking Water and Sanitation, Param Iyer. India's Swachh Bharat mission is, I think it's the world's largest attempt to change behaviors. I think the target of somewhere around 550 million people to stop defecating in the open. And we've invited Param to give us an overview of that mission because we believe there's a great deal that can be learned from that effort that will contribute to other efforts elsewhere. And after speaking, Param will join with the remainder of the panel. Sorry. Param, the floor is yours.
Thanks, Jamie. Good afternoon. We have just seen the very good presentation on the JMP. And again, SDG 6.2 on open defecation. More than half of those defecating in the open are in my country, India. So, we like to say this in India, that the SDGs cannot do without India achieving its target, and that's this program. So I'm going to just take you through the Swachh Bharat Mission Gramin, which is rural. It's been going on for just over 3 years. So we celebrated the 3rd anniversary on the 2nd of October, which, as many of you know, is Mahatma Gandhi's birthday. And so the deadline, again, is linked to the 150th birth anniversary of Gandhi, which is 2nd October 2019. So let me just, this is a quick overview of this program. And some of those numbers, by the way, in the JMP at 2015, there's been huge improvement over the last 2 years. So you'll see some updated numbers in my presentation. Okay, so here it is. Now, in October 2014, which is when this program started, was launched by our Prime Minister, there were, in rural areas, there were about 550 million people who defecated in the open. And today, that number has come down by about 250 million. So it's a huge decrease, if you like. You know, it's the size of a country like Indonesia. It's a big amount. And you can see that the deadline is 2nd October 2019. It's quite symbolic, as I said, because it's also the 150th birth anniversary of Gandhiji. Now, you know, this year I'm probably preaching to the converted in this audience as to why this sanitation is important. But let me just give you the Indian context. So in India, diarrhea kills over 100,000 children every year. Huge impact on stunting. About 40% of kids in India are stunted. And of course, we all know there's a direct connection between the lack of sanitation and stunting. And then, you know, there's another program in India called Skills India. So India has got a very good demographic dividend. There's a very young workforce. And if, you know, 40% of the kids are stunted, and sanitation is a major cause of that, you can imagine the effect, the adverse impact it's got on the productivity of the country. So again, important reason to do sanitation. And then, of course, it goes without saying, the security and dignity of women and girls in India who have to go out to defecate in the open, typically after sunset or early morning, and it's got all kinds of risks involved. Now, so this is the major departure we're talking about in the Swachh Bharat mission. We had earlier kind of incremental drip approach to sanitation. And I'll show you a graph after this which shows you the progress made over the last, if you want to take it back to 70 years of independence or you want to take it back 30 years, it was growing incrementally till this program started. And essentially the Prime Minister, you know, took sanitation, if you like, out of the closet and put it squarely on the table. So this is the comparison. I've actually borrowed this idea from my good friend Val Curtis, who's not here today. And this is what we are saying. So, you know, when President Kennedy said he'll put a man on the moon, it took 9 years. And our Prime Minister, when he put Swachh Bharat on the table, said that he's going to get the job done in 5 years. So, and we're talking of 1.25 billion people. Of course, more than half of them, about half of them practice open defecation. So I think the point here is that this is a very big idea. It's a risky idea. It's politically risky to come out and make a statement like this because it has to be achieved. So I think that there are many people who sort of don't appreciate the bigness, if you like, of this idea of making India open defecation free in 5 years and giving it a timeline, and we are actually making progress in that direction. So for us, this is a bhag, and bhag in Hindi actually means to run. So, you know, there's a Hindi version of BHAG. So how is this program unique? Because rural sanitation has been going on in India for a long time, for 30, 35 years. And I think the first and foremost change, I think the game-changing difference between Swachh Bharat and earlier programs is this is the first time that the Prime Minister of India, the Chief Executive of the country, has personally invested in sanitation and made it his #1 flagship program. And that's been made a huge difference. Again, behavior change and usage. You know, many people think this is only about building toilets. It's not. It's about how do you change the behavior of people and to make sure that they use those toilets which are constructed. And then this policy shift is quite important, from outputs to outcomes. So the moment you talk of ODF, open defecation free, signifies the entire village community accepting the idea that the entire village needs to be ODF to get the maximum health impact. They're accountable for it. It's a community movement. And so that ODF measurement is a very important policy shift made under the Swachh Bharat mission. There's a lot of emphasis on verification and sustainability. In earlier programs, there was talk of slip backs. So village became open defecation free, and then it slipped back to open defecation status. So here, there's a lot of emphasis on sustaining the ODF and making sure that any declared ODF is verified at multiple levels. It's a people's movement, a Jan Andolan, as we say in Hindi, and an idea which the Prime Minister has taken forward. It's everyone's business. It's not the business of my ministry or any state government. It's everyone's business. And unless it's implement it in that way, it will not be achieved and it won't be sustained. So that's another key idea. And then huge public resources have been pumped into this program. So you can see that's about $25 billion. This is government public sector financing. And that's the commitment made for this program. So this is the acceleration I was telling you about. And my friend Val Curtis was in Delhi a couple of days ago, and she was fascinated by this graph. So you can see from this, the steep increase. So this goes beyond the 2015 time period of the JMP. You can see the increase, the rapid increase in coverage in India over the last 3 years. Today we are at 70%, and when the Swachh Bharat mission started, we were at about 38%. So this is a snapshot of overall progress under this program. You can see from the map on the right, the colors keep changing on this. You know, I took up this job of mine about 1.5 years ago, and at that point, most of the states were in the brown category. Today, you see those 4 red blotches, if you like. Those are the big 4 states which we monitor very closely: Jammu and Kashmir, UP, Bihar, and Orissa. So these 4 states are just under 50% coverage. And we focus a lot on supporting these states to get out of that red category. But if you look at the progress since 2014, so about 50 million household toilets were constructed. The second point is on the solid and liquid waste management, which is another important part of Swachh Bharat. It's not just about open defecation free. So about 250,000 villages have ranked themselves on a scale, which we call a Village Swachhata Index. All the villages along the Ganges River, another major priority, have become open defecation free. This is across 5 states. And 6 states in India have become open defecation free. The most recent was Gujarat on the 2nd of October, a week ago. And we expect about 10 or 11 states will become open defecation free by March 2018. Now, the good news for us is that 2 independent national surveys have shown that usage is very high. Because this is one question which is thrown at us quite often. You're building all these toilets, how do you know they're actually using them? Now, we are reasonably confident, and these surveys bear that out, that usage is above 90%. So even in urban areas, there are about 4,000 cities in India, and about 1,400 cities have become open defecation free. It's not part of my ministry, that's part of urban, but we work closely together. And about 261,000 villages have become open defecation free. And you can see that coverage is about 70%. So we've got another 30% to go. So overall, I think we're making fairly good progress. Wanted to emphasize a little bit the focus on verification and sustainability. Because many people say, how does it happen? How does a village get declared open defecation free? So first of all, in an open meeting, which we call an Aam Sabha, the village will declare itself so that there's transparency, everyone attends that meeting. And then there is a third-party verification from an outside agency outside the village, but within the district. That needs to be done within 90 days. And there's another verification for sustainability after 9 months, so 6 months after the first verification. We also have third-party verifications. The Quality Council of India did a 140,000 household survey in May, June, which basically came up with that figure of 90% usage. The independent verification agency under the World Bank assisted project has just started. That'll be 100,000 households. We send out national level monitors from the government of India to the states. And then we have the National Sample Survey Organization, again, which is doing its second survey in the coming months. There is a sustainability protocol to make sure that there's no slip back, that there are mechanisms at the village level, there are incentives for the village and the district to remain open defecation free, and that's something which we monitor very closely. Now, again, this is about behavior change, as we said, so communication is at the heart of this program. So the information, education, communication at 2 levels, at the mass media level and then at the interpersonal communication level, are critical to the program. So what you might call above the line communication, we have large-scale events where, we had the Prime Minister addressing 6,000 women local representatives on International Women's Day to sort of motivate and celebrate the leadership role of women in this program. We also have big events on days like International Toilet Day, Independence Day, etc. A lot of mass media campaigns on TV, radio, outdoor. You can see Amitabh Bachchan, he's an ambassador for us. He does a campaign called Darwaza Band, which means shut the door on open defecation, mainly targeted at the men. Because again, the feeling is that women will use the toilets if they have them, more or less, but men may not. So this campaign is targeted at the men. But then the more important thing for us is what we're calling below-the-line communication. This is the interpersonal communication. This is about triggering at the village level. You have trained grassroots level motivators. We call them Swachagrahis. And basically they go from village to village. They emphasize the importance of sanitation. They trigger behavior change in the village and get them to adopt open defecation-free behavior. So we have about 650,000 villages in India. And the idea is to have at least one trained motivator or Swachagrahi in each village. We've got already about 250,000, so we've got another 400,000 to go. Idea is they will stay in the village. They're usually from the village. They trigger behavior change. They're trained by what we call Knowledge Resource Center NGOs. And then they will stay on in that village to make sure that the ODF is sustained. Nigrani Samiti is a term used. That's a village committee which is actually going out and making sure that people don't defecate in the open. So you've got kids, you've got elderly persons, they go out in the morning, sometimes they'll blow whistles. So there's a fine line between sort of naming and shaming and getting the community to decide how they want to deal with sort of offenders, if you like. And so we let the community decide that. Coercion, there have been some cases where people in sort of over-enthusiastic local government officials have tried to force people not to defecate in the open. And we crack down on that from the government of India because we want to make sure that there's positive behavior change and it's not negative. This model is something which the Prime Minister is personally pushing. That is, sanitation is everyone's business. So Swachh Bharat is not only about open defecation, although it's the most important part. It's about how to get to a clean India. And here, all ministries in the government of India, in the state governments, they're all involved with sanitation. So there's a thing called a Swachhata Action Plan. Swachhata, by the way, means cleanliness. So every ministry in the government of India now has its own dedicated cleanliness action plan with their own funds. They don't get any extra money. And they have actually committed, 12,000 crores is about $2 billion. So in this financial year, in 2017-18, all the 76 departments of the government of India have diverted funds, have reallocated funds, and have committed about $2 billion to mainstreaming sanitation in their own sphere of work, in their own core agenda. Swachh iconic places. So, whether it's the Taj Mahal or whether it's the Golden Temple in Amritsar or Tirupati Temple in the south, the idea is that all these places, how can they be cleaned up to an international standard? So all the pilgrims and the tourists who come there, they understand that sanitation is a core part of the national agenda. As I mentioned, 250,000 trained grassroots level motivators, Swachagrahis, are already in place, and this is being scaled up. Swachhata Pakhwada, Pakhwada means a fortnight. So every fortnight, 2 ministries have got to focus only on sanitation. And this is very closely monitored. So there's a whole sanitation, it's become everyone's business. They have to focus on it. And the reason for that is that the Prime Minister tells all his cabinet ministers that he wants them to focus on sanitation irrespective of their department. Another very interesting initiative with the support of the private sector. So the Tata Trust, the Tata Group, has given us 600 young professionals from fantastic backgrounds. They're from IIMs, they're from IITs. They've come out for a year to work only on Swachh Bharat in the field, to support the district collector, to support the district development officer. So they're both the eyes and ears of the collector on the ground, as well as our monitors, if you like, giving us feedback from the ground. So these young professionals have made a huge difference and shifted the momentum in Swachh Bharat. There is a funding receptacle, if you like, called the Swachh Bharat Kosh, maintained by the Finance Ministry. So if anyone wants to donate to the government, they can do that. And this has already collected a large amount of money, which is then handed over to state governments to promote sanitation. So this, again, is a little representation on how sanitation is everyone's business. Our development partners, UNICEF, the Gates Foundation, the World Bank, WaterAid, NGOs, basically we're all in it together. Faith leaders. We've got a huge interfaith movement called Jiva, where religious leaders from different religious denominations come out and encourage people to promote sanitation. So in the end, it's about how can we get everyone involved to participate in the Swachh Bharat mission. Recently, there was an initiative called Swachhata Hi Seva, which means that sanitation is itself a service, doing service. 15 September to 2nd October, launched by the Prime Minister. We had over 90 million participated over these 17 days. You can see this picture. This is the first picture, by the way, of our Prime Minister being photographed next to a twin pit toilet. You know, he was photographed a lot with a broom in urban areas. And I requested him, I said, sir, can we get a picture of you in a rural setting next to a twin pit toilet? So he's very expertly laying the last 2 bricks in the honeycombing structure. And he did it very professionally. So this is in his constituency in Varanasi. And so he did those bricks and then he came out. But during this 17 days, there was unprecedented mobilization. The idea was to build momentum for the coming 2 years. So we've got another 2 years to go to get the whole job done. And these 17 days have given us a lot of momentum. So there were massive campaigns, public places, doing Shramdan, which in Hindi means contributing labor in both urban and rural areas. So this is just over now, but it's given us a lot of momentum going forward. Involving school kids. Now, during this campaign, we had an unprecedented participation by school kids. We believe, and I think many would agree, that school kids are great ambassadors for sanitation. And they can convince their parents, they can convince their communities about the importance of both hygiene and sanitation. So we had 30 million essays, 30 million paintings, fabulous paintings by primary school children. The one on the left you can see is one of the award-winning paintings. And this, the essay on the right is actually very touching. So I made a presentation to the Council of Ministers, and I read this out in Hindi. And you know, they were quite struck by it. So there's this girl who's telling her father, can we please have a toilet in our house? And you know, so there were millions of essays like this. It's all about awareness. So the kids are, you know, sort of full-fledged members or partners in this whole campaign. And so we work a lot with the kids. Now, the impact already created by the Swachh Bharat mission. A good study was done for us by UNICEF recently, which looked at the economic impact of sanitation. Now, the bank had done a study about 9 years ago, which estimated that the lack of sanitation in India costs us about over 6% of GDP. So then we were interested in what's the impact at the household level. So this study shows us that 50,000 rupees, that's about $800, $900, can be saved by each household just by practicing safe sanitation. So again, you know, this is both a marketing tool to go and tell, when you tell households, why do you need sanitation? It's not just for health reasons or the dignity and security of the women, but actually you can earn a bit of money as well. So this is a very useful study. And then there was a study done by the Gates Foundation for us on the health impact of sanitation. And something which we all intuitively know, that so we compared ODF districts with non-ODF districts. And you can see how the incidence of diarrhea comes down in ODF districts, stunting comes down. So again, there's much more work to be done. This was a quick study done, but I think the impact is already being felt. Now, I'm coming to the end of this. Some of the lessons we have learned along the way in the last 3 years. I mean, we've been talking about this for ages, political support. But, you know, we've actually got it here. This is, I think, without any doubt, if not the top program of the Prime Minister, certainly in the top 3. And this high-level support has made all the difference. You know, it's the cabinet in the government of India, it's chief ministers. Everyone is taking it seriously because the Prime Minister has put his own he's invested a lot of political capital in this program. So that's been absolutely critical. Then, you know, things scale, not drip, drip. So we feel now that what happened in the last 30 years was pretty much drip, drip and incremental. And, you know, you can argue, some people say 5 years, it's impossible. We don't think it's impossible. We think it's possible. Many of the young collectors have told me that in their districts, if you don't get it done in 6 months or 8 months in campaign mode, and we're talking of quality here, not just building toilets, it'll be very difficult to sustain and maintain that momentum over a long period of time. So we think that the change must come fast, like a revolution. It cannot come incrementally. And again, for us in the government of India, it's critical to have continuous engagement with our states and with districts. So I'm like a traveling salesman. I visit state governments, we go and meet chief ministers, we motivate collectors. But unless we have this continuous engagement in a federal country like India, water and sanitation are state subjects. So there's really not much you can do from government of India except give a bit of financial incentive, do some training, do some technical assistance. But we need to continuously engage. It's engage, engage, engage. And getting everyone involved. So not just rural, urban, it's about getting politicians, it's about getting faith leaders, it's about getting school teachers. It's become now a national program where everyone owns a piece of the Swachh Bharat. And then again, the low-hanging fruit always works. Unless you build success, it's difficult to generate momentum. But we got to do both. So there are 650 districts in India, but 220 are already open defecation free. So we work on sort of 2 tracks. One track is the low-hanging districts which have high coverage, which can quickly become ODF. But at the same time, we know that the districts in UP and Bihar and Orissa are going to take a lot of time. So we've got to work with the sort of high-hanging fruits as well, if you like. So, but you need to get early successes, early wins to build the momentum. And then it's good to have competition. So we are a federal country, and we like to have healthy competition among states and among districts. So we have national awards. We encourage young collectors, young district officers to get into this competition. And the housekeeping, for the last 3 months, we have been focusing on all the boring stuff, the verification, the sustainability, the conversion of insanitary to sanitary. Again, you need to keep your eye on that ball, or we will miss out on that as well. And going forward over the remaining 2 years, we need to keep the momentum going. Difficult states, as I mentioned, there are 4 of them which are below 50%, large states, which together account for about 55% of the problem. So we need to maintain that special focus. We need to make sure that verification and sustainability is emphasized. The behavior change campaign is very important. We took a recent policy decision that fund transfers from the central government to the states would only happen if a certain percentage of the IEC funds were actually spent to incentivize the states to spend more and more of their IEC money. And again, how do you scale up capacity building? A big challenge in India, if you look at the scale at which we are operating. So one idea is to have this trained grassroots level motivator, the Swachhagrahi in every village. But again, we need to shift the lessons across. So we periodically will have meetings of 200, 300 districts, get them to exchange experiences, because we want whatever has worked in one part of India to work in another part, even if the context is different. And then, importantly, solid and liquid waste management. Again, what's a clean village? It's got to be open defecation free. It's got to have effective solid and liquid waste management, although that's more an urban problem today, but it's going to catch up with us in rural India very soon. And especially in ODA, it's got to look clean. So solid and liquid waste management, fecal sludge management in peri-urban areas, again, something which we need to focus upon much more in the coming months. So again, Mahatma Gandhi was the original sanitation champion of India. He was very, very big on sanitation, and this is a quotation from him. I'm going to leave you with a small film which was made by BBC Action Media and supported by the Gates Foundation, which will give you some flavor of what's happening in India. Let me see if I can get this. Can you play the film from there?
Swachh Bharat Mission or Clean India Mission. It could have just been the name of a government program or just a slogan, but it has become a call to action, a people's movement. And that has happened because people are getting the message loud and clear through innovative media that's drawing people in, making them listen and understand.
पहले हम लोग बधाई मांगने के लिए घर घर जाया करते थे.
जल्दी 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 देर हो रही है.
लेकिन अब हम लोग बधाई के साथ साथ स्वच्छता का संदेश भी देने के लिए लोगों को जाते हैं.
भैया को समझा दो, भाभी को समझा दो, किसी गाँव को स्वच्छ करवा दो, तुम दिल्ली से भी जाया है. ಅದಕ್ಕೆ ನಮ್ಮ ಸರ್ಕಾರ ಸ್ವಚ್ಛ ಭಾರತ ಮಿಷನ್ ಅಂತ ಮಾಡೈತೆ. ನಾವು ನಮ್ಮ ಮನೆಯ ಕೆಲಸವನ್ನೆಲ್ಲ ಬಿಟ್ಟು ಬೀದಿ ನಾಟಕ ನೋಡಲಿಕ್ಕೆ ಬಂದಿದ್ದೇವೆ. ಅದಕ್ಕೆ ದಯವಿಟ್ಟು ನೀರಿನ ಬಯಲು ಮಲ ವಿಸರ್ಜನೆ ಮಾಡೋದ್ರಿಂದ ಅನೇಕ ರೋಗ ರುಜಿನಗಳು ಬರ್ತಾವ.
ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ನೋಡಿ ನಾವು ಸ್ವಚ್ಛತೆಯ ಬಗ್ಗೆ ತಿಳಿದುಕೊಂಡೆವು ಮತ್ತು ನಮ್ಮ ಗ್ರಾಮವೂ ಸಹ ಬಯಲು ಬಯಲುದೆಸೆ ಮುಕ್ತ ಗ್ರಾಮವಾಗಿದೆ.
जब कोई पंचायत या गांव खुले में शौच मुक्त होता है तो उसके उपलक्ष्य में गौरव यात्रा निकाली जाती है. हमने भी पास के गांव में गौरव यात्रा देखी और हमने भी ठान लिया कि हम जल्दी से जल्दी गौरव यात्रा निकालेंगे.
बस 3 महीने में हमारे गांव में हर घर में शौचालय बन गए, इसीलिए हम भी आज गौरव यात्रा निकाल रहे हैं.
हमें यहाँ की गौरव यात्रा देख करके बहुत ही अच्छा लगा. हम भी अपने गांव में जाएंगे और शौचालय बनवाएंगे.
Innovative waste management practices and newly built toilets across the country are proof that the message is finding its mark and is pushing people and individuals among them into making the mission their own.
Thank you.
That's really quite inspirational and sets the scene very clearly for us. Both we have some really solid numbers that I hope will make our friends from WHO and UNICEF very happy. It was a great version of making sanitation everyone's business, coming home into practical reality. And I confess, just for a moment when you spoke about the head of state as the communicator-in-chief and showed us the picture of Prime Minister Modi, just for a moment my mind flashed to someone with a big mop of blonde hair and just wondered if we could do the same in this country one day. I'd like to invite up to the stage the other members of our panel, and I'll briefly introduce them as they make their way up onto the stage. Luis Simas is the head of the Water Quality Department and leads drinking water regulation in Portugal, and is the official representative of Portugal in the European Commission for Drinking Water. Brian Arbogast leads the Bill and Melinda Gates Foundation's efforts to bring groundbreaking innovations in sanitation technology and new ways to deliver sanitation products and services to people in the developing world. Her Excellency Frenesh Mekuria is Ethiopia's State Minister for the Ministry of Water, Irrigation and Electricity and a member of the Ethiopian Parliament. She previously served as State Minister of Agriculture and Natural Resources and as State Minister for Women's, Children's and Youth Affairs. And while she's getting settled, I'll also acknowledge the presence here today of His Excellency Minister Alemayeho to this conference. And I'd like to invite to the stage Catarina de Albuquerque. Catarina is the Executive Chair of the Sanitation and Water for All Partnership. And importantly, she was previously the first UN Special Rapporteur on the human right to safe drinking water and sanitation. I'm going to make my way over to the panel also and hope that the microphone's still working. And say that I'd like to take us back for a moment to that great description of the world in which we live today that we received from Tom and Rick. And like to turn to the panel and ask for some reflections on, okay, we've got a good story, we've got a clear story, but does it tell us the whole picture? do we actually see the texture and the important components, and are the metrics that we're being given really the things that we most need at not only international but also national and local levels? And I wonder, Minister Mekuria, could I turn to you first? I think the story that comes out from Ethiopia's One Wash program may be something we want to know a little more about.
Okay, thank you very much. I'm glad to be here as a panelist to share experience of another country and to tell about the experience of my country also. And also, I'd like to thank the inviter, UNC, for inviting me and my team to this conference. And I would like to mention that UNC are an important partner for Ethiopia. Have worked with UNICEF and Plan International in undertaking critical health impact studies of CLTS and WASH. Thank you very much. And also, I want to thank the presenter of report of Joint Monitoring Program, Tom and Rick, because what they present is the reality from the point of my country achievements regarding especially MDG. And during the end of MDG, Ethiopia is one of the countries who selected by UN to provide data for the preparation of SDG also. So my country is also contributed for the SDG preparation because we registered as a country remarkable achievements in MDG. So this is the reason why we selected to provide data for the preparation of SDG. And also, I would like to share you that based on the invitation from the United Nations Economic and Social Council, we present our SDG report by 2070 voluntarily. We already submitted a voluntary national review based on the goal which they provide for us to report. So after I mentioned this one, Tom and Rick, they gave us information regarding the drinking water supply and sanitation and hygiene issues. Regarding this, my country progress has made in improving access to improved drinking water sources. The country has also met the MDG target by increasing the percent of population with access to improved drinking water source. We achieved 57% in 2015. We know that the target was achieving minimum 50% population to have water supply, drinking water supply. So this, based on these achievements, now we are progressing regarding this one. And the government of Ethiopia has prioritized addressing the lack of access to water and sanitation facilities and poor hygiene practice. Regarding this one, we have One Wash national program, which is aligning harmonizing and also integrating our stakeholders, partners, and all things. So based on the Paris Declaration, in this One WASH national program, we have one government-led plan, financing, and also reporting system. So we developed this one since 2013. We shifted our work towards that one. Previously, before 2013, it was project-based, but we shifted to the program-based implementation of water and sanitation issues. And this one brought stakeholders together around a joint vision of One WASH national program, which address water, sanitation, and also the hygiene issue. Tom and Rick also mentioned about the issue of sanitation. Regarding sanitation, we progressed, but we need to work more on it during this sustainable development, for the sustainable development agenda to achieve. But we have progress regarding open defecation. Before 2015, it was very high, but we achieved in 2015 about 29% open defecation. So we are now plan to make open defecation free by 2025. And this achievement came from the government commitment, as Indian friends mentioned. And we deployed about 40,000 health extension workers at grassroots level. From this one, about 98% are women. So they are working house to house regarding the issue of sanitation and hygiene. So because of that, we registered a very good result regarding that one. But when I say we registered, we have to make it 100% open defecation free. And regarding hygiene issue, also we registered similar thing. So when I see from the presentation of Tom and Rick, I think I can say that the presentation and the data it is true and it is real when I take from my country's view of points. So this is very important, and now we already moved to SDGs, and we are working on it. We know that SDG goals are not like MDGs, but it's built on the experience of that. But it is ambitious and it is also comprehensive. When we take even goal 6, 1 and 2, previously it was about water supply, but now it is not only water supply. It is beyond water supply. It talks about, it demands the quality issue, safety issue, and also wastewater treatment issue. These all things are included here. So we have to work aggressively to achieve these issues, these targets. And as mentioned from presenters, we also did this inventory, and we have data regarding water supply and also sanitation. And also we did together with UNICEF this water quality issues. We did the assessment regarding that one. So we now take that one as our assignment to progress on it. Thank you very much.
Anyone else on the panel?
Yeah.
What else do we know?
So some comments. I loved seeing the update with the new GMP data from the summer, and you know, I'm always reminded we've set the goals so much higher in the SDGs than the MDGs, and I was a huge fan of that. Because when you also see the disaggregation, so the idea that we'll be able to kind of shoot for higher goals, you know, in water, it's not sufficient to have access, you know, an hour or two a day of poor quality water. That's not what we aspire to. But being able to get the data that sees who's got basic, who's got safely managed, and how does that span across rural, urban, different income levels. I mean, for the sanitation, you know, we had this, the MDGs told us that a lot of work left to do in rural, but it seemed like, you know, people in cities were using toilets, so we were all good. But of course, what we know is in many developing cities, it's as if there's institutional open defecation because, you know, they're using a toilet, but the waste doesn't go very far. People are still getting sick, huge health burden still. So it's fantastic to see the aspirations. I'm very much looking forward to more data on the fecal sludge management side. I think, if I recall, when I looked at the data, Japan was the only one that really was providing data of, you know, of all the on-site toilets, how much of the fecal sludge was actually getting treated. So we've got a lot of work to do there, but I think it's the right work, and so I'm excited that we've got the baseline and we're ready to move forward.
Picking up on what you were saying and on the presentation that both Rick and Tom were making, it is difficult, well, it's difficult not to think of how things were 6 years ago and the Berlin. Now, I think we should all buy T-shirts or make T-shirts saying we were in Berlin. I also was in Berlin. So, and the discussions back then in Berlin where we didn't even know would we get a goal, nothing. So we were a little bit all rowing in the fog and we kept rowing because we were convinced somehow because we are optimists or idealists, I don't know what we are, or we are simply stubborn, and we kept rowing and rowing and rowing, not sure that we would actually get there, and we did get there. And I think, and nobody pays me to say what I'm saying, but I've said it already in Stockholm, I think that the work that JMP has done and is still doing and will continue to do has been, I think, simply amazing. This does not mean that everything is perfect, and this does also not mean that they are gathering all the information, but I also think that it's also not up to you, solely up to you to do it. I think that you have a chunk of work to do. I would push you further, for example, when you look at access to water and sanitation outside the household or beyond the household. And I remember when I was still a rapporteur having these discussions with you, you were saying we have to start somewhere. Okay, let's start with schools and health facilities because this is the politically correct place and the sexy places to talk about. I would push you to go to less politically correct places. What is the level of access in prisons, places of detention, etc., etc. The hot topics. But I understand that you are not, okay, let me say it positively, that you are politically smart. So let's start in the more politically comfortable zone and then progressively move. But, well, I don't have to tell you that you have to move because you know that perfectly well, that you have to start, you have to continue, not start, because you have done it already. You started already pushing the boundaries. You have to continue pushing the boundaries. But I think that it's also a lot, there is also a lot that has to be done at the national level in order to bring more granularity to the numbers and also to make sure that we know what we are talking about. For example, you talk about inequalities. I think, well, there is, and I remember we talked about that a lot in that working group that I was chairing on inequalities, that we need to have that data coming from the countries. It is the country that has to understand who is being left behind, why are they being left behind, and doing it in a multi-stakeholder or participatory fashion. And in that regard, I've said it in the past, I think that the Sanitation and Water for All partnership could contribute to that. So, for me, the conclusion is the numbers are not telling us yet the whole story. I think it's impossible for the JMP numbers to tell 100% of the story, but they are telling more and more of the story. The story has to be completed with national data, but I think that the story is being more and more accurate. And basically, I think the conclusion is there is no single country on track, which is, when we look at the new data, which is an accurate story.
Just a couple of points to add. I think that, again, big improvement in the JMP, so congratulations, particularly for putting hygiene promotion on the metric. I think that's fantastic. That is very welcome. My question is, again, what are you going to do with this? It's a little bit like what Clarissa was asking. So I think that, this should be used as an advocacy tool, taking it to heads of government. And, my Prime Minister doesn't need this. And by the way, I think we are on track. So I don't beg to differ with Catarina. We're not waiting till 2030. This is 2019. But that apart, I think that this is a very useful advocacy tool. And so you need, beyond the numbers and the analytics and the data and trying to improve it, I think you need to use this for advocacy. You need to take this around. You need to market this. You need to show this to heads of government, particularly in countries where there isn't enough political will. So I would use it extensively for that.
So, Param, that was an incredibly confident statement. We are on track. Yeah? I'd like to maybe look at others on the panel for, are these targets achievable? And I was hoping, Luis, could you lead us in? Because there's an interesting story comes out of Portugal of very rapid change in the last few years.
Yeah, but thank you, Jamie. But if you allow me, I'd like to say 2 or 3 things. One, I was amazed by the presentation of this study, this program in India. It's amazing. It is the confirmation that it's possible to make a silent and a peaceful revolution, and India has very good examples in its history of making peaceful revolutions. So I would highlight that, and I think it must be a reference for everyone. Concerning the data, I have to say that I would like to highlight one sentence that Jamie said, that from the MDGs to the SDGs, we are using more and more the administrative data, the national data, the government data. And that is good, not because I work more or less for the government, but because that means the national governments are becoming more transparent and more reliable on their data. And I think that's moving forward. I also would like to pick up the suggestion of doing some advocacy with this data. And I'm sorry I have to pick up the example of Angola because I was born there, and I didn't like to see that analysis, of course. I know it's true, so if I was WHO or UNICEF, I would write a letter to the president of Angola with very strong messages saying that he's really not on track and he has to do something to change the process. Concerning Portugal, yes, we have a long history, but in what concerns to the wash sector, I can speak for the last 25 years. And the last 25 years, they were amazing. For you to have a picture, in 1993, so yesterday, we had 50% of safe water in our taps, 50%. So it is a number that was unacceptable. Nowadays, 25 years later, we have 99% of safe water. And if we look at sanitation, in 1993, we had less than 30% of the households connected to sewer systems, and nowadays we have more than 80%. And of course, you can ask me what was the solution, what was the magical trick to do that, and I can list you 15 bullet points starting on political awareness and financing programs and so on and so on. But I think the key solution was for some reason we could create or enable an environment where dozens of thousands of wash technicians worked every day with the same goal. And proudly, I can say that most of the work was done after the creation of an independent regulator for the wash sector. And that is one of our key messages, or at least one of my key messages, is to highlight the importance of having an independent regulator. Someone that is looking at the sector and has total liberty, but at the same time technical competence to define the rules and to tell the wash sector what they have to do. We discussed this weekend about the role of the regulators and what's a regulator, and we've been discussing this for many years. And I am still surprised because people think a regulator is something like a policeman, some institution that is punitive, that is only there to find the faults and to apply some fines or something like that. And we don't see the regulator as a policeman. We see the regulator, well, we used it a lot last weekend, as a teacher or as a parent of the wash sector. Someone that is cooperative, someone that is part of the solution, not part of the problem. And I think that was the secret for the Portuguese miracle. There was someone that said that last 25 years in Portugal there was a Portuguese miracle in the wash sector. But it was not a miracle. It was hard work, and it was the ability of the regulator and the water providers and the laboratories and the health authorities to keep up the work together. And there is another thing that is very important in the regulator, adding to independence: transparency. Transparency is quite important. And the regulator has all the conditions to be transparent, because he doesn't receive orders from the politicians, although are the politicians that can make the difference. And the good example of India shows that it is the politicians, the ones that have the final decision, that can make the difference. And the difference is always on people, not on governance models, not on management models, not institutions. The difference is always on people. But the institutions, the governance models can create or enable environments that promotes these kind of evolutions.
I would like to jump on what Luis said. Of course, I agree with everything you said. So you were talking about the importance of an independent regulator, of having a vision and a policy and etc. and the framework, your 15 bullet points from your PowerPoint presentation that you didn't make. No, but yes. I think that another thing is, and I think that now it's easier to think that way with the SDGs, I think. Because I think that it's important to think of the progress that we have made, because this encourages us, okay, and gives us strength. But I think that we also have to focus on who is still left out. And when I was rapporteur, I remember talking with Louise and the former regulator, Jaime, etc., and saying, look, but who are the people who are the 1%? The homeless people, the Roma population, poor people who during the financial crisis got disconnected and who got reconnected again, for whom wash services are no longer affordable. So I think it's to keep on the work. So it is achievable if you do all the 15 bullet points that you were referring to, but if you keep alert, that if you stay alert to the new changes, to the new challenges that occur. We will talk later, I think, about climate change. So there are new challenges coming up constantly, and I think that part of being a good politician is then adjusting the policies to the new challenges, being bold and courageous. I think that's what you need, right? Having the vision, and also being humble to accept the reality and face the existing failures. For example, what you were referring to, Param, bringing out the numbers. So if you don't know the reality, how can you address it? So having the courage to say 550 million. Wow.
Yeah, I can respond to Catarina saying that it is very important that someone, because I'm not saying here that our system is perfect and that we achieve all, of course not, and Catarina, when she was a special rapporteur for UN, she emphasized those points, and Leo Eller is still emphasizing those points because he made a country visit to Portugal in 2016, and we had some meetings, and in his report he emphasized some points. It is very important, but the creation of this, and that is one of the things that I would like also to leave to this water conference where science meets policy, which is, I would say it's a very important lemma. How do I say that in English? Is the possibility of the international agencies like WHO, like UN, like UNICEF, to give a clear message to national governments that there are some models, for instance, for the water sector, the creation of independent regulators that can work with transparency, with some degrees of freedom. It is probably the most suitable situation to achieve the SDGs. And I think that's one of the messages that could be left out here in this conference.
Yeah, just a quick point. I agree completely with Catarina and Luis. I think that you asked, is it achievable? I think it's got to be homegrown, right? It's good to have the SDGs, it's good to have the international community, it's good to have the JMP report. But there's got to be something like Bangladesh. They did it on their own, right? They might have taken 17 years, they're close to 100%. So unless there is a political commitment in country, you can nudge from outside, but in the end it's not going to happen unless there's a commitment from within. And that's got to come from the highest level. And we are seeing that in India.
One thing we saw, I'm sorry, go ahead.
Thanks for the water.
Okay, thank you very much. I think the issue is about the achievability of SDGs. Before I say yes or no, I want to mention some issues regarding this one. First of all, the SDG is building on the success of MDG, while it has new targets and goals, for example, economic inequalities, innovation, peace and security, and also the climate issue. This is included in the SDGs, but it was not in the MDGs. But we are not starting from the scratch. We are building on the success of the MDGs. So I have experience from that and input from that. This is one thing we have to see. And from the commitment of this leadership issue is also coming on board. Regarding that one, globally there is a broadly accepted agreement of our grand challenge. SDG talk about that one. SDG talk about the development of every country regarding social, economic, and environment. And also the other issue is when we see the SDGs are far more driven by the member states than MDG. So member states are agreed regarding this issue better than MDG. So this is one commitment, it's general commitment. But when we say achievement of SDG, we have to think about the targets and goals comprehensiveness, and also it is ambitious. We can't achieve these goals and targets by acting like business as usual, and also with small scale work. We have to think about broadly to address the goal and the targets regarding these SDGs. So one issue we have to see is that we have to integrate the SDG with the national development framework. So it also demands regarding this one. Every country is doing to develop their country. So when we integrate the SDG with the national development framework of every country, so we will achieve. I can mention about the experience of my country, for example. during the MDG era, we aligned and integrate with our national plan. We call it growth and national plans. The plan is a span of, this plan is about 5 years. So we aligned MDG with this growth and development of a national plan of our country. And now, then, by 2016, we started preparing the second, we can say, GTP, Growth and Transformation Plan, from 2016 up to 2020. It has 5 years span. So during this preparation, there is also the preparation for the SDGs. It goes along with it. So this is a good opportunity for us. Then the second one comes, the third GTP comes from 2021 up to 2025, 5-year span. Then this is also will align the issue of SDG with our national plan. And finally, we have 5 years, so the fourth one also aligned with this sustainable development goals. So this is one thing we have to do to work on it. And also we have to work aggressively because there is another challenge is coming, the climate change issue we faced in the beginning of SDG implementation. For example, in my country from 2016 and 70, we faced about the drought issue. So this is one problem which we are facing. So we have to think about it how to work on this one. And the other issue is a financial issue is also coming on board as a challenge, especially for the developing country, low income economy country. So this is also needs partnership, international partnership, and alignment of the finance and better use of the finance which we have in our hand. So this issue has to be considered. Otherwise, I think we are trying and also exerting effort to achieve this SDG. Otherwise, it will create the problem. We know that one. Yeah, I want to comment on this.
So one of the things you mentioned was the need to changes in approach. When I think back to the MDG era, the Millennium Declaration had human rights in it. There was nothing in the MDGs. And then they are back center stage in the SDGs. Now maybe, Catarina, can I turn to you? That's a big change in the frame we have before us. But what does that mean in terms of the kinds of approaches that we need to apply? What do we need to do differently?
Well, since I don't know, or maybe I dreamt of the question that you are going to ask, I have here 7 points. Nothing was prepared.
It's less than 15.
So, well, before I start making my 7 points, one of the things is, and I'm looking at Tom and Rick, it's the way in which global monitoring is done. Are human rights being incorporated? And I would say yes. And this is already part of the change. Are they looking at the things that we are supposed to look and that the human rights demand them to look at? And I think the answer is yes. I know that you are not putting the words human rights in every single page of your baseline report. I don't think that that's the end of the world. I've always said that we have to do it. We don't have to constantly be putting the expressions everywhere. I think that we simply have to do it, and I think that this is what the JMP is doing. I think that basically what do human rights mean? They mean that all countries are off track. And when I think of sanitation and water for all, I think, well, maybe that's a reason why we have such an interesting number of middle-income countries knocking on our door and joining. I'm announcing here, because this is such a small audience, that, for example, Indonesia will join SWA tomorrow. Honduras will join SWA tomorrow. Bhutan is going to join SWA tomorrow, if nobody objects between now and tomorrow. But I think this is not going to be the case.
Is that an invitation to object?
No, I don't know. I hope no steering committee member is here. So just to tell you that there is this big interest, from middle-income countries to join SWA, which was an interest that didn't exist before, maybe because they all felt as MDG heroes. And now they know we are not heroes. We need to talk to each other, and we need a forum where we can improve. Elimination of inequalities has to be the priority. What is the rate of progress that I am making in my country among the most marginalized? Enough, like you were showing in the slides, enough to reach 100% in 2030. And this is a type of a mindset that I think needs to change, because before we believed in the trickle-down approach. Now I think we learn it doesn't happen. The other thing is human rights have to make us more curious, have to make us ask more questions and challenge ourselves. And I already mentioned before the access to Goal 6, outside the household. Who is not getting access and why not? What are the political obstacles? Maybe it's not a priority to give access to asylum seekers because we want to get rid of them. Is this correct? It is not. Is this a human rights violation? Very probably it is one. And again, places of detention, etc., etc. Okay, how do we determine who is being left behind? I was mentioning it before. I think we all need to do at the national level consultative processes where we manage to identify who are the major segments of the population who are being left behind. And then we can identify why and then find the solutions. I mentioned the homeless, for example, here in the US, or smaller rural communities, again, here in the US. People who cannot afford to pay the water bill, like some of the people I met in Detroit, and who get cut off. And after determining who these people are, then we are better able to bring solutions. Then, I'm almost finishing. The legal consequences of human rights, meaning that there are obligations of immediate realization, like the elimination of inequalities, also adopting a national plan, having a vision, having a national plan for the sector, having a budget for the sector. I think these are immediate steps. But then the progressive realization, knowing that we have to constantly give the right steps in the right direction, and that any retrogressive step is in principle a violation of human rights. Ensuring accountability, ensuring participation, and also measuring and ensuring sustainability. Before I was asking Rick this morning, how do we measure sustainability? Are we measuring those people who are losing access, or are we just measuring those who gain access? And if somebody is losing access, how do we address that? Number one, how do we get that information? How we do address it? And then to finalize, the other implication is that countries, we have to be aware, countries have to be at the driver's seat. They have to lead. Others, namely non-governmental organizations, other development actors, have to support the government in reaching the SDGs, and we have to do that, and governments have to work in a multi-stakeholder fashion, investing in systems, in the enabling environment, but then in making sure that other stakeholders are able to participate and to influence and also to contribute and find solutions. So, very easy. Thank you.
So that's the 7-point plan to achieve the human right to water and sanitation. Just do it and everything will be fine. I'm going to look around the panel. Other issues of the approach we're taking, changes we need to make to the approach, whatever dimension they might take.
I think it's incredibly important to surface the differences. So in the slides we saw from the JMP data, the fact that you're differentiating and seeing who's doing, which cut of the population is doing really well versus not doing so well. In the sanitation space and looking at urban sanitation, probably many of you might have seen, the diagrams that show the human waste and how it flows in the city from a toilet or open defecation through to transport. Is it getting treated or not? It's an amazing way to, in one view, see what's happening in the city. We affectionately call those SFDs. If you want to see some, I'll be showing some when I talk tomorrow at 1. But what's also amazing is you look at that and it's just one view. What if we looked at the poorest in that city? You would see a very different diagram. And I think just exposing the data in those new ways will lead to different actions and a lot of ahas that lead to us really having to step up our game.
Yeah, and I was just going to say on this topic, the community approach which we are trying to follow in India essentially gets people from all sections and of that village, right? And all castes as well. So, that's one thing which we think is being overcome through the community approach. So when the triggering takes place at a community level, and everyone identifies which is the spot where people are defecating in the open, which are the communities which are doing that, and then it actually brings them together. So that approach, whether you call it CLTAs or community approaches to sanitation, it's actually bringing about more social cohesion as well. So that's one thing we're quite proud of. It's not addressing the whole story, obviously, but it's a step in the right direction.
And I would like to add, and it is important on this, diminishing the inequalities, the role of the regulators. One of the things that we discuss a lot is the difference between urban and rural systems. And the trend in the world is that the regulators just look at the urban systems and not the rural systems. Many times the legal framework only has issues for urban systems and not for rural systems. And this weekend also we discuss something, and we are in a university. We have a lot of teachers around this room. What's the best teacher? He has a class with good students, average students, and bad students. What's the good teacher? The one that makes the good students a genius? Or the ones that converts the bad student in an average student, the average student in a good student, and the good student in a genius? That's the good teacher. And I think the regulator must look at the rural systems, and the regulator can be an independent agency or can be a Ministry of Health or Ministry of Environment, but look at the rural systems and bring them up. And bringing them up is not creating exemptions or exceptions on the legal requirements, is helping them to comply with the legal requirements that were stated for the urban systems. And that was the approach that we had in Portugal, and we've looked at for the last 10 years, and of course we saw a difference between the performance of the rural and the urban systems. Today we also see a difference, but it's this size. So it is important to have this kind of approach to somehow also to help to diminish the inequalities between the systems.
I'd like to try and challenge the panel on one last item, and maybe every member of the panel would come back on this. But we've talked a lot about what we do within drinking water and sanitation, how we govern ourselves and do things. And yet when I watch the television every evening, it strikes me that we're bombarded from all sides with big external forces. Frenesh, you mentioned climate change and weather extremes. That's one. Here we find the very value of science and evidence questioned at an absolutely fundamental level. Catarina, you've talked about migration and people movement and the challenges that brings. And in different regions, we see overt racism and clashes between population groups. So stepping back on those external factors that could knock us off course, could I ask everyone to pick one of those or something else that's external and give us a thought on how we're going to have to adapt and cope over the coming period?
I pick up on science and I will shut up. Every time I wake up, there is different news of a different emerging contaminant, a new problem that is arising on water and sanitation. Everyone knows a few months ago, it was the microplastics. Suddenly, we couldn't drink water because it was full of plastic. And the regulator has to deal with all these problems. So it's very difficult because we cannot solve the problems that science is yet trying to solve. So this connection where science meets policy, this connection is quite important for us. And our approach is to maintain a strong connection with universities and research laboratories, so we can be advised by the wise people of the subjects that will be our concern tomorrow. Because the first, or one of the first things that I learned when I started to work for the Portuguese regulator was the regulator must be one step ahead. But to be one step ahead, you have to work a lot. But it is impossible to do it alone. So the connection with, with academia, with the science people is quite important.
Okay, thank you very much. Before I go to the climate issue, I want to add one thing regarding the leaving no one behind issues. And I think poverty eradication is at the heart of 2030 agenda, we know that. And so we have to address the all population, reaching everyone regarding the development. So one solution which my government is doing is that expanding on the pro-poor sectors, for example, education, health center, and water supply, and other these pro-poor sectors. So when we invest in the pro-poor sectors, so we are addressing the poor people, then now because of that, so they will benefit, and then we didn't leave anyone behind in achieving the sustainable development good goal. And the issue which I picked is that we know that climate change is an issue nowadays, and the SDG agenda is also one agenda in the SDGs goals. I mentioned this one from the practical viewpoint. For example, last year and before last year, there was a drought issue in the sub-Saharan Africa especially, and our country is also faced such kind of problem, but we managed with our partners not to harm the population. When we talk about climate change, it is highly affecting the water supply issue. It brings water stress, and we observed that many of our groundwater, especially shallow groundwater, they try not to give water for the community. So we have to think about differently to solve this problem. So based on that, now my country, we developed a resilient wash program regarding this one. So this is very important, and the other issue is we have to manage our watershed management, and natural resource management is very important. So we have to address such kind of change, because we are facing, we can't avoid this one, but we have to act on it differently. So this is the approach now we are going on.
I think climate change is going to make some very tough decisions for people who are managing water at the city level. And if you think of a future where people are really trying to make sewers extend to reach the bulk of the folks in a city, including the poorest, which almost never happens in a developing city right now. If you're also facing water stresses, the idea that you're diverting all of that managed water just to transport human waste around the city, I think is going to look less and less attractive. And so I'm really excited about the innovations we're seeing around toilets that don't require a water connection, around treatment approaches that actually can recapture the water, turn it into something of value, distilled water for industrial uses. So there's a lot of exciting innovations happening there, but I think that people are going to have to shift their mindset from a future of the whole city is going to be sewered to one that's a lot more water savvy.
Yeah, I was going to say on a related topic, technology is one of the most disruptive forces in today's world. Things are changing every second. And so I think in the sanitation and water business, we've got to keep up with that. So in India recently, we, and I think Brian will love this because the Gates Foundation is big on technology. So we organized something called a Swachhathon, so hackathon, a Swachhathon. And we're looking for, so we came up with some, to address 4 or 5 key issues. One of them is usage of toilets, right? So how do we know, I've been asking this question from Jamie and Val Curtis for 20 years. How do we actually find out whether people are using toilets or not, right? So it's a pretty intrusive process. You go and ask questions, do you observe, how do you do it? So we said we want a technology-based solution to usage of toilets. And some of these youngsters, young engineers in India came up with fascinating ideas which we're trying to scale up. One of them was a sensor in the toilet bowl, which is a smelling sensor. So hydrogen sulfide, ammonia, and with an infrared sensor. And so now we're actually going to, they've come up with a prototype. So I think that technology, we've got to keep up with technology in our business as well. Yeah. And that's something which we are trying, it's very, very difficult, but that's something we're trying to do.
I want to focus on the political challenges. The political, and you referred to several of them. And for me, the solution, one of the solutions is partnering. Partnering with other sectors, with women's rights movements, with people working in the area of nutrition or health, etc. I think that if we work together, we create a better basis to defend the importance of universal access to water and sanitation. I also think and to keep the political momentum and the political will alive. So partnering with other sectors, having multi-stakeholder forums. I know I mentioned this before, but I really think this is important. And I think that, for example, the research and learning community, as well as the civil society community, can have a very important role at the national level to keep the flame alive and to keep the political will. And then, so I'm moving from here up to here, and I then think that bringing different governments together with other stakeholders, obviously, at the global level, I think it is powerful. I agree with you, Param, that it has to come from within the country. But sometimes there are countries that need a little kick, a little push. So bringing them together at the global level, talking with their peers, understanding where they have failed, understanding where others have succeeded, and being inspired. What you did this year, I think, at the SWA high-level meeting in Washington, D.C., even though you are not yet a partner, but you will become one soon. I think that sharing what you are doing in India is an inspiration to others and also tells others this can be done. Yeah. So I think it's bringing people together at the global, at the national level, but then also bringing them together with other sectors. I think it is powerful to resist these horrible tendencies that we have been witnessing recently.
What a marvelous, inspirational point to end on. Thank you for that. I mean, I think we've got, I feel very positive at the end of that. We hear that we know an awful lot about the world we live in. Our world has adopted ambitious targets that will make it a far better place for future generations. We've got clear ideas about the approaches and then the changes and approaches that are needed. We've got an interesting mixture of leadership and external nudges. Was that what you called them, Catarina? A little bit of a kick sometimes. And we can imagine a clear role for science and information to help within countries and to keep that process on track. I think that as a package sets the scene for this week and is also an incredibly positive way of looking forwards. Could I ask everyone, can you help me to thank these guys and also to thank Wro for your time?